This is Hold My Stethoscope.
Hey everyone, welcome back to Hold My Stethoscope. We've got some special guests here with us today. So I'm Brittney and I've got my girl Felicia.
Hi, everybody.
And then we've got our two special guests today with us, Kara and Anthony. So Anthony's been here before, but Anthony, do you want to give everybody a little rundown of yourself?
Sure. Hi, my name is Anthony. Was a former ICU nurse. I was an ICU nurse for 7, maybe 8 years, and now I'm a student nurse anesthetist.
And then Kara. Kara is Hold My Stethoscope fam, but she is the K in our FK bad. We thought we were going to have the whole alphabet today, but it's all good.
We're missing the D.
We're missing the D. One day we'll get the D back and we'll have the whole crew.
Yeah.
Kara, tell us about yourself.
Hey, everybody. So I've been an ER nurse for probably the last 6 years. I've been a nurse for going into my 11th year and ventured into all kinds of different nursing, including hospice, ICU, and neuro. But ER is where I've found my love, my passion, and here we are. I'm ready to chat with you guys and have a good time.
Yay. Welcome, Kara. Welcome.
Thank
I know. We're excited
Thank
she
you.
can finally be with us. She was sick the last time we did this, and then Dom had his thing. So I do promise you one of these episodes, the full alphabet will be here.
Yes.
All right. So we're just going to have kind of a smorgasbord episode. I don't really know. We're just going to wing it and just see what happens. So
Yeah.
grab your stethoscopes and listen in, and hopefully you enjoy this episode. So first thing we're going to do, we're going to kind of go around here. Oh, I love it. Did he just bring out his stethoscope?
Oh, yeah, it just happened to be on the floor.
I love it, Anthony.
Yes. Good job.
I love it.
I love it. Our guests are bringing props. It's beautiful. It's a beautiful
He
world
grabbed his
here.
stethoscope like you said.
I do. I know. He's a great listener, guys.
He is.
All right. So let's go ahead and start with our wildest patient story. Felicia, do you want to start this one off?
Mm,
It's hard. You know, we take care of so many patients across our
we do.
lifetime. It's like sometimes hard when you're like, what's the best patient story you have? I was like, I don't know. I got like millions of them.
Well, we've heard like
Sure.
We
my
did hear-
best.
Yeah, if you did not
Like-
listen into I think it was like our 4th or 5th episode, we did have a penis cage that we talked about, which I think is still your wildest story. So.
That would be by far the wildest of them all. Yeah, I have to say. Yeah. I'm trying to think what else was a wild, like patient or whatever that, we've had. Well, we've had patients that were Baker Acts and stuff that come in and kick nurses in the face and stuff because they would get too close trying to hold them down, trying to give them some medication, which I understand. But I'm like, you see them kicking and swinging, like protect yourself, like something, use the well steps, whatever. But, we've had those kind of patients.
But
I
that
need you
brings
to
up a good
protect
point because
And
I
it-
feel like the doctors are always like, okay, go medicate that patient. And I'm like, okay, but what about my safety? And how come you
Yes.
get to sit down at your pretty little desk and feel safe? Meanwhile, I'm going in, with my great security team, hoping I can bring this patient down. And at which point does it come on like, okay, what's appropriate?
Right.
What do
Yeah.
we do here?
What do we do
That's
here?
like such a good point because I feel like some of the wildest stories I've had is like patients like that are acutely psychotic, right?
Yes.
Completely combative, angry, and you know where. And once again, I feel like we showed on the providers last week, but where are the providers? They ain't nowhere to be found.
They're
Like,
nowhere
they're
to
not
be
the
found.
ones who are getting hit, kicked, verbally abused, like all of those things. And then you're like, we need to medicate this person. They're like, oh, 0.5 of Ativan.
0.5?
Yeah, I'm like, put them in the K-hole, okay?
For real.
You gotta go in the K-hole at this point. Because
do.
I'm not going back in that room.
No, I'm
You got
not.
one shot, okay?
Mm-mm.
Hey,
No, I'm
at
not.
least you guys get out. Like the patients go away after a while.
That's true.
When
Anthony.
I'm stuck with them in the ICU, I got 12 and a half full hours with someone who's off
That's
their
true.
rocker.
No, you're
What's
absolutely
like one of like the wildest things you have? Because I feel like we could kind of like say it in a way, like you're right, Anthony. Like we have these patients, but then for the most part, we get rid of them in a relatively quick time frame, unlike you guys.
right.
So, like,
Right.
I
what
mean, you guys definitely have your long cycles down there for sure.
body like
I mean, like the alcohol withdrawal and drug withdrawal patients are usually some of the hardest. I mean, the one that stands out to me is I have had, alcohol withdrawal patients. They just have no idea what's going on. They're just completely lost. Talking to you like it was in a patient's room and he's ordering like he's at the drive-through, like trying to drive his bed, and then proceeded to like somehow
Yeah.
get on the bed like on all fours face down and go to the bathroom that way, and it's just like
Oh my
whoa.
goodness. My goodness.
We recently had an ICU patient break a bed in half, like an ICU bed in half,
and
and
What?
restraints. Okay. So I can only imagine what that ICU nurse went through. And I'm thinking
What?
in the ER, like, okay, I'm just gonna sedate this person. This person, every time that they would wake up from their sedation, this is how they would behave and they would have to be taken back down.
What were
So
they
I
on?
wow.
it was alcohol withdrawal.
Yeah,
Oh,
alcohol withdrawal is actually the
wow.
worst.
Oh, it is the worst, and a lot of people don't realize that.
There's
It
I just want,
really
like,
is.
PSA to any non-medical people that are listening, alcohol is by far the worst, like,
Worst.
drug that you
It
can
is.
be on detox from, like, it just makes you the sickest, like, it's
Oh,
the
yeah.
worst. Alcohol
It
is
is.
the
It's
worst.
serious. Yep.
And be honest with your providers if you ever come into the hospital about how much you drink, because or else we're all in for a rude awakening and you're gonna wake up wondering who you are, where you are, and what happened to you.
Yep.
Did you guys
Yep.
ever work in a hospital system where they would order alcohol like as a med,
Oh, yes.
Oh, yeah.
and
Absolutely.
give it
You'll
in
go
a
get it out
Absolutely.
of
beer?
the fridge and put it with their dinner.
Absolutely.
What
Here's
Here's
your
your nightly
course.
beer.
it's crazy, like, I feel like that should be more common than it probably is. Like, I've never worked in a hospital. Well, I don't know, I guess I work in the ER, which is different, but, like, in a
You work in a hospital system that does it.
oh, see, I didn't even know that because, like,
Yes.
I don't know,
Mm-hmm.
I'm not an inpatient nurse, so I don't do those things, but, like, it's surprising how much probably time and money is spent, like, detoxing these patients for them to come right back in when if we just medicate them with what they're medicated at home with, then we wouldn't have
Right.
a problem. So, I'm
Yeah, it's
surprised it's not,
weaning.
like, as maybe out there as it should be. It's crazy, though. Yeah, alcohol
That
withdrawal
is.
patients, damn, that's a good one because those are, like, the
Or
worst.
I remember those that were remember when that spice first came out?
Oh my
They
god,
was
people
buying
eating
that
people's faces
stuff.
down here.
They was crawling up the wall, no lie, honey. We'd be like, "Oh my god, what in the world kind of stuff is that?" Oh my god, it was crazy. It was so crazy. What was it like potpourri or something? They was doing. I
Asshole.
don't know. Bath salts.
Bath
That's it.
salts, yeah.
When you said
That's it.
wildest story, I immediately went to my patient with bath salts and
See?
the
Okay.
amount of work. Not only were they crazy, but the amount of work and like getting them to dialysis, stat dialysis, and
Oh,
all of these different things because you're dealing with electrolyte imbalances on, but then you're also focused on their like psychosis and you're just like,
yes.
what is going on here? You don't know how to help them and you know they need help and you're scared because
You
you
scared to
like what?
death.
No
Like a
egg shield is
vice
Mm.
gonna protect me from that.
No.
It's crazy. Like, I remember I wasn't in Florida, like, I feel like when this happened, and of course it was Florida, like, that had the biggest incidence of bath salts, like, people eating each other's faces off, and you're like, "What the hell's going on in Florida down there?" And obviously now I'm here, so I'm like, but it's nuts. Like, you're like, "What is people are eating or doing bath salts and becoming cannibals? Like, what is happening in
What's
the
going
world
on?
right now?"
Right.
Like, wild shit. Yeah, I got drugs. Stay away from 'em, guys.
Please.
It really is true though, like, even some of, like, the bad traumas or things like that, I feel like there's a big proponent of, like, just drunks and alcohol
Drugs and
that go with
alcohol.
Yes. Mhm.
God bless.
Yep.
Um, what okay, this is another good one I was kinda talking about, your most annoying shift that you've had in your years of nursing. What is, like, what and I once again, I know this is tough because most shifts can be annoying for one way or another.
Listen,
Mm.
nothing is worse than looking at your assignment sheet when you first come into the ER and looking at your doctor lineup and knowing that you're gonna have blood cultures and lactic added on to every single order set, and it won't be from the very beginning. They'll get trickled in, you'll come out of the room, and then the next one will go in, and then you know you're not safe because your next patient with the other doctor is gonna be the same way, and you know that you're in for that shit show for the entire next 12 hours. That, to me, is the most annoying shift in the world. I mean,
Or
I can
a
deal with
shift.
family members, I can deal with, craziness, acuity, whatever, but dealing with the trickling in of orders is the
It
bane
does.
of my
It
existence.
it is awful. But on top of that, what's annoying is to look at the board when you come in, and sometimes the people you're working with, you
Mhm.
already know, my God, she ain't gonna do nothing today. She ain't gonna help nobody. People gonna be having to do her work. It's gonna be this person over here talking about it because they like, she happens. I'm not gonna help her. Like, those are the days that used to really, really drive me crazy. Like, you look at your team and you're like, really? Really? You couldn't give me one nurse that's gonna help out, or one, you know what I mean? Like, those were the shifts that would drive me crazy when you
They
knew
knew
you
you
was
could
gonna be
handle it.
running
Gotcha.
all day, or they was gonna be constantly like asking for help all day long. Like, they just couldn't even handle their assignment, you know?
That's
You just
just
want to
because
be
you
like,
were
go home.
charge nurse extraordinaire and they knew you could handle it. So,
Oh no,
You
never,
are the
never be in
ultimate
charge.
resource.
Trust me, I know. I know. I know.
so I feel like mine was because I feel like Anthony has a very different perspective than we do, obviously being ER people, but like ties into a little bit because I worked in obviously at a lot of different places when I was traveling, and by far my biggest pet peeve was coming in and getting an assignment that was holds, and you knew like, and I worked a lot of overnight shifts. We knew we were never getting beds, so like. As an ER nurse, I'm sorry. I know like that we got lots of inpatient nurses that listen and all this stuff, but like biggest pet peeve to an ER nurse is when I had to have a whole assignment of holds. It was just awful. Like I hated it. It was brutal.
And then we say, I hope they don't expect us to do those inpatient orders. We're not give all them meds.
No. I'm like, I gotta go
In-person skin assessment? What?
I know.
What?
The
I gotta
truth
go to
comes out.
STDs
What?
to
We
put
do
out.
focus assessments here. We ain't doing no head to toe. I don't care
Well,
I
about
the
your
thought
patient's been
head.
in
That's
the
not what you're
ER
here
for
for.
48 hours and none of the orders are
Exact.
done.
No, sir.
Like, what?
Morning
No,
meds.
I'm
What?
not doing
What?
that.
everything's still in the planned state.
Blood cultures and
What?
lactics from 2 days
I
ago.
kept them
For
a
So ER
real.
nurse,
They
I
did
thought we
sepsis
didn't
cured.
need
They
to do
cured.
urgent orders. I thought we only
Yeah.
had to do if it was stat.
Right. And don't you
Yeah.
dare, when I go to give you report, ask me if I did. What? No, I did not.
I'm alive.
Yeah. I'm still getting ambulances and everything coming while no, ma'am. I did not do your morning meds. No.
You know
I
God,
what?
feel
that's
That's like,
bad though. We get hold nurses where I'm at, and we're very blessed for that. But I
we
feel
do
really
too
bad.
now.
I feel really bad for those hold nurses because they get shoved in there with us ER folks, like in the same area, and they just get thrown into our lifestyle. And if you're not used to the ER lifestyle, it can be
It's rough. It's
a,
ghetto.
a rude awakening.
I'm like,
So,
It is.
and they just get thrown
It's
in there.
ghetto.
So I
Here,
am
call it what it
so
is.
thankful. I'm like, what can I do for you? Like, how can I help you? Because Lord knows if I was them, I would need some help dealing with those
Oh, I
kinds of
would be like,
attitudes
I
and
think I'm gonna just
personalities.
go home and abandon this shift today. Yeah. Like, no.
Here's my badge. I'm leaving.
yeah.
I'm out of here.
Oh
No.
my gosh. All right, Anthony, what do you got? What was your like
uh,
thing?
I just was gonna say, one of like the early lessons I learned in the ICU was like, don't ask the ER nurses questions.
You're a smart
And
man.
that sounds really bad, but it's way easier to just look through the chart and spend 3 minutes doing that than to sit there and ask you guys a question and then you guys are like, well, so, which sounds bad, but you have 4 patients, like random things coming through the door. So it's
Oh, and the
just,
ambulances are coming, and you still need to triage this one over here, and all this
yeah.
going on, and
I
you got
used
the
to go
bake rack
down
over
and
here, and yeah.
just
I'm
pick up my
glad you
patient
pick
and
your
be like,
battles because you know what's up. You have enough ER friends
And
to
you
tell
already know
you
we didn't
don't
chart
that's
do
that
that's
that.
also
ID,
true.
even though we put it in, Anthony. You already know we didn't chart it. It didn't
I
even,
know.
it's not in the record. It should be. But
We
Well,
gotta go
sometimes
look
I'm
man,
like,
for
oh,
it.
we
We
just
gotta
didn't
go
never
look
get
where the
around to
ID is.
charting it.
that's why it's just easier to walk down there and
There
just
you go.
do it
I think it's
myself.
funny
That
because you
sounds
could
really
probably
bad.
tell a better assessment of the patient by looking at the chart than some of the nurses that actually are giving you reports.
Oh, yeah. Girl, I would just talk till they couldn't even ask me anything. I would just keep going.
The
You don't even know.
ADHD and hardcore, like, I know they don't know, I didn't know either. I was like, "I
Yeah.
can't keep track."
No.
And then I'm on to the next thing while you're still talking to me and whining and complaining about why I didn't chart this line, and it'll get done, don't worry. Take
Yeah.
the
It'll
patient.
be charted by the time you come down here and get this patient or whatever. I don't know. Or they bring it up or whatever. Yeah.
Yeah, it's not even worth you
Very
choose your
good,
battles.
Anthony.
Yeah.
I think you're right. Choose your
Well, you
battles.
have to have like you probably had like a provider or staff or like something. Like what was an ICU? What's an ICU pet peeve?
Oh, Glucomander. I mean, I feel like there's a lot of I don't know. I didn't really have any issues with too many things. I think, kind of to Felicia's point, sometimes it was the people you work with.
Yeah.
Um, and like I loved some of the people I work with, but there was one guy I used to work with. He would be like, "Can you watch my patients? I'm just gonna go get breakfast." And then he'd be gone for 2 hours.
Right.
And
That's
I'm
what
like,
I'm
"You have
saying.
now I have 4 ICU patients." Then I finally learned he was getting in his car and going to the gym and coming back.
He was getting games while you were doing
Yeah, and I was
Are
like,
you kidding me?
"No."
Who
I
found
think he did
who
get in trouble
found
for it,
out?
but
Who found out that's what he was doing?
well, he just told somebody one day.
What?
He was not the brightest, but
My God.
I was like, "Do you know how fireable that is? Like, that's like patient abandonment."
For
Wow.
2 hours.
Yeah.
So how long
See,
did it take you to catch on to be like, no, I'm not going to watch your face?
after he told somebody.
He did eventually, I don't know if he was asked to leave. I don't know what the situation was, but he did end up leaving because he was a contractor at the time. So, yeah,
Oh,
I used to hate that. I was like, "Please don't put my rooms next to his."
wow.
Time I would be next to him and I'm like, "Oh my
The nerve.
God."
That's crazy.
Or in the
That's
ICU,
terrible.
having to travel sucks.
Like
Going
with your patient?
with your patient, yeah. Because
Yeah,
like
you
that was
guys
one
gotta
thing I
push
used to
that
hate.
bed. That's hard.
How do you guys feel about the transporting at the change of shift? I'm getting a lot of pushback between having ER and having ICU. I hear it constantly. Like, it's
I don't think it's
inappropriate. It's
good. I don't
inappropriate.
think it's
I think
good.
it's inappropriate, but
It
I don't know
is.
what the workaround is necessarily. They talk about making a no-fly zone, but I think that's the ultimate goal.
It's difficult because ICU are doing their report. It's more than how quick the ER would be doing. Like there's a lot longer
Oh
report.
yeah.
So at what point does the patient come up? At the organization that I worked for, when I was in the emergency room, we waited for the 7:15 mark either way, and then the patient was transported. However, ICU is still in report, but what can you do? I don't
Right.
know.
I know
That's
you
a
gotta
tough
keep
one.
throughput at one side, but then the other side is patient safety and, getting things moved along appropriately as well. So it's one of those things that it's always kind of that a losing battle, I feel like, because there's no perfect answer.
No, there's not.
Well,
There's
Anthony,
not.
what's your take on this from the ICU perspective?
I mean, I do agree that like getting a patient at 6:30 p.m. was like the worst
It's the worst.
because you're finishing up, you're charting, you're getting ready for like shift change, and then trying to settle a new patient. It's not like it
No.
takes 5 minutes. Like it's long. And
Hmm.
then the worst thing was then you just gave me report, and now I have to regurgitate everything that you just said, and it's this big game of telephone, and then nobody knows what's going on with this patient, and they're just here.
Yep.
And then that poor nurse has to then sit down and try to look up everything that's going on. It's just kind of it's a shitty way to start and
It
end your
really
shift.
is. It
Yeah.
is. I agree. And
I
then
mean,
why
I
should the nurse that is leaving take report on this patient when there's an oncoming nurse? It would be better for her to get the report. It's just too much. It's too much.
right. I mean, and ICU reports are long. Like you have to
They
think
are long.
some of our patients are in there for days, weeks, months. So like it's not like you can just be like, this is John Smith.
Right.
He's here for abdominal pain. See ya.
Like
You
No.
we
have to kind
do.
of know
He
You
just
every
got
waiting
the
at
step
the
of.
map
test
here
tube.
to the
Right.
map here to the map here,
Yeah,
and you're
Yeah.
trying to piece it all together.
right.
Meanwhile, trying to pull the patient over with all their drains, cords, lines. I mean, I know when I admit a patient up there and help out, it's well over an hour. So I can
Yeah, that's
only
what I thought. It was over
being
an
that
hour.
ICU nurse that's like, "Are you kidding me?" Like, what?
Yeah.
Yeah,
But
yeah.
on the counter side, like sometimes there are ICU nurses that like tell you way too much information and you're like,
What's
okay.
this?
I don't
Like,
wanna know
yeah,
all that, I'm not gonna
right.
remember all of that. What
They have
needs to
blue
be
eyes
done?
and
Like,
okay.
whatever. Like, that's what I wanna know. Well, what's left to be done, honey? I
Yeah.
figured out,
Mhm.
you
Felicia,
know?
don't lie. You want to know their favorite color too.
No, I don't. Don't care at all. You said they had abdominal pain. Did the CAT scan get done? If not, then okay, I know that they're gonna be going for a CAT scan or whatever needs to be ordered. I don't wanna know anything else about nope, not even interested. Not at all.
Crazy. That's so funny. All
I
right.
feel bad for ICU nurses though, Anthony. Today they were up there, they were dealing with this one patient. It's like the patient is not moving on though. At least in the ER, they're eventually moving on. And the ICU, the patient is not going anywhere. They were like, we got to get this patient something, some precedent, something to settle this down. But then that patient gonna wake up or do whatever and start it all over again. It is
Mm.
nonstop for them on the unit. Whereas eventually the ER, we're gonna get rid of them.
Like, how was that with continuity of care? Did you like having the same patient for days, weeks on end, or were you kind of like sick of them at some point? And were like, can I please assignment?
In the ICU, there's like you can tell if it was a good shift or not because like the offgoing or ongoing nurse will be like, "Are you back?" And if they're like, "Yeah," and they're excited about it, like, "All right, I'm gonna have a good shift," because like they didn't have a bad day or night, whatever. Um, but I actually really liked the continuity of care. Like when I
Okay.
had sicker patients, it was easier because then I could go home, I'd come back the next day and I'd be like, okay, just fill me in the last 12 hours. Like I don't
Mhm.
need a whole report. What happened? And then I could jump in, my day would get started a lot faster. I already had a rapport with the patient or their family member. Like it was a lot easier. But then there's other patients where you're like, please do not give me this assignment back. Like you're begging the charge nurse, like, don't do it.
You're like,
Put me
"I'll buy you
anywhere
lunch,
else.
whatever it takes. Do not
Yeah,
give."
Please
I'll
don't
take
give me
3
that same
patients.
assignment.
Yeah.
He wore me out. Yeah.
But
Yeah.
there are some that we call, you say one and done because you can do one 12-hour shift and they get the best of you. And it's not always their fault because they don't know what's going on, but
Right.
it takes a
Right.
lot of patience.
What was your favorite, I guess, patient or disease process to take care of? Like, because you worked a lot with like cardiac ICU. Did you have like a favorite type of patient to take care of?
The ones that didn't talk back.
LVAD.
Yeah. Intubated, sedated, on
I like
ECMO.
see those are my favorite patients too from an ER standpoint. I love to have the intubated patient. I
I do.
love to hear all of the respiratory like machines going off. Doo 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 doo. I want to hear it. Like I want them all sleep.
I just like the critical thinking aspect of it.
I
Like
do
anybody
too.
can pass pills and give ginger ale, like, but when you're on all these different machines and you have to think through things and you
Right.
know,
And your
y- y-
autonomy level, right? I mean, those doctors rely on you. You're
They
their
right,
do.
doctor.
yeah.
Right.
Hmm.
Absolutely.
So, I mean, but that took a long time to build up to that. There's a lot you have to learn.
Mhm.
Which
Right.
we're going to talk about that in a minute. We're going to kind of end with that segment, but let's kind of do a little bit more of like pet peeves. So we talked about this in the last couple episodes. So I'm going to give us eight, eight kind of pet peeves, and we're each going to choose our top two, and we're going to ask our viewers to see who had the best two picks. So we have
Yeah.
our first one. I hopefully she's gonna write this down. She's got this. Our first one from our episode a couple episodes ago, the family member that comes and asks, "Can I have a warm blanket when you're doing?" So we got that one. We've talked about this episode as well as last episode when providers piecemeal orders and they do the one off. So I feel like Kara already loves that one. We have got a patient, and this is probably more in from an ER perspective, but the patient that comes in, we've talked about this before too, Felicia, with their McDonald's order telling me, I know what's going on in my body and I want XYZ done. We have a difficult family member who is either a medical professional or watched house. and
Or Dr.
they've
Google.
got their honorary doctorate degree and they question everything you're doing. We have the patient that is complaining of 10 out of 10 abdominal pain and eating. And then what was that? Was it 6 or 7? Felicia, keep me honest here.
That was 5.
That was no.
Thanks for
God.
calculators.
So we have the family with the coding patient. We have the piecemealing of orders. We have the person coming in asking their McDonald's order. The family member who's dang, you're right.
Annoying family, and then the patient complained of abdominal pain but eating.
All
Yeah.
right, let's see. The other 3, apparently I can't do math very well, guys. I mean, forgive me, it's fine. We have EMS not calling. Sorry, Anthony, this is another one. EMS not calling, showing up at your door with an absolute train wreck. We have we're going to give Anthony one here because clearly I didn't do my math correctly when I calculated this out. But
What do
we
you
have
mean you want me to
an
come up with one?
insulin drip and multiple other drips at the same time, and they're not sedated and they complain. Gotta throw a wrench in there somehow. And then we have the pharmacy calling about every 10 minutes about one of your patient's medications because they can't get that right. All right. So as our 2 guests, Hera, since you're our newest guest, you get to go first. Which one would you like first?
Obviously, for me, the piecemealing of orders is my biggest pet peeve, but I 100% cannot stand when we've got CPR or some other major event going on and families asking me for anything. I feel like you're
Mhm.
coming out of the room, you see the crowd, you see the dead person in front of you trying to be resuscitated. I honestly have no words for that.
And they stand like this.
Yeah, like
Yeah.
I know.
My mom needs a
it
blanket.
makes me want to go do a few laps
Read
before I go back to
room.
your room because I need to.
Read the room, people.
Yeah.
From. Because I give them what? One long blink.
Yeah, the police are long wing. We should have put that in there too.
Her
So
signature was long.
rude.
I mean, dang, Carrie, you probably do have the best 2 out of all of
Yep.
them. So Pierre's probably going to already win this one. But Anthony, what are your 2?
Well, I got to take my Glucomander one because I just
I
despise
mean,
Glucomander.
yeah,
Insulin drips.
and
Boo.
they're awful. Because then you also, like, I'm going to plug you for a second because then you also have to take into all those electrolyte abnormalities you have to take into account for and replacing all of those. So that's a pretty awful one. So I'm
Yeah, that's a night shift thing.
Now that's one of my favorite things. This is
I
an
actually love to do that on night
NSP
shifts. So
problem. This is an NSP problem. Yep.
I worked day and night shift, so I feel like I could say that because I have been on both sides of that. Gotta take the electrolyte. And you said the EMS dropping off a train wreck.
like with
That happens in the ICU, either from the floor, a rapid from the floor, and they're in a freaking sand bed or something stupid, and you're trying to push that thing, or even the ER. Oh, the patient's fine. They're on room air, and you walk in and they're
They're obtunded, needing
yeah,
BiPAP
yeah, and
Yeah.
they're
things.
starting CPR. You know,
Yeah.
they
Yes,
just
I
they
agree.
just coded in the elevator.
yeah. It always happens. The elevators are cursed.
The elevator.
Yeah, they
Probably
are.
they pooped in there too.
Yeah,
I swear.
They
exactly.
did.
They were
They
pleased.
did. They pooped. That actually is probably my pet peeve. Oh, they just pooped. They just
I
peed.
had a
Like,
sore
just own
spot.
it. They've been sitting in it for 2 hours. We can tell.
Exactly.
We
Just
can't
tell me
stop
you
that.
didn't have time. I'll take it. It's fine.
Like we gave like hours ago. Like
Oh yeah, the KX that is in their bed.
Yeah, because we gave it on the way they're coming up there.
Yeah, that's considered a to-go order in the ER.
Yep.
Uh,
And even the doctors know it. Don't you
Yep.
dare.
Just
oh,
they even say give it like 20 minutes before setting them up.
Okay, whatever. They're gonna be sipping. They're gonna serve that up on their way up there in the elevator.
Yep. It just happened in the
Okay.
elevator.
Drink it like it's chocolate milk, please.
Like, just tell me that. I don't care. I would do the same thing. You know what I mean?
At least he's honest about it.
Yeah.
that's why Anthony's our people. We love him.
Right.
Okay, so those were your 2. Felicia, I'm gonna let you get
Oh.
I'll get the last 2, whatever they are. So what are
Oh,
your
you
last?
already know for me it is that family with that blanket. That's my story all the way. Don't you dare in the middle of us doing compressions or doing anything critical, walk up and say, my mom, we've asked for a blanket. We've been on our light. You what? Do you not see that the staff is in here trying to save a life? You know, and then they look at me. Thank you. That's one of my pet peeves. You know, the other one, it's not on this list. So
Okay,
I'm going to
yeah.
tell you. Don't you dare walk out in that hall on your phone, honey, like you own, like that's your house. It's in the floor in the hall of the emergency room having a conversation like you're at home. Like, my favorite thing to do is this, excuse me, ma'am. I'm gonna have to have you go on back into the room. We're discussing patient information out here. So I just think it's rude just to be out in the hall, like you leave your family's bedside and you come out on the phone and you're like pacing up and down the hall like you live there on the phone. It drives me insane. It does. I'm just looking at them like, are you serious? Like, that's not cool.
So
So
if you have Felicia in your department, don't ever leave the patient's room in general. Like, never go
you
out.
can
Hey,
leave the room, but you need to leave the room. Like, leave the room
The
and go
hospital.
to the bathroom. Leave the
leave the
room and go
hospital.
to the, but you're not going to pretend like the hall is your house. So now everybody, I'm going to tell you, it really is it's such a bad pet peeve of mine that when I was going through treatment, guys, there was a lady that would come in every day on the phone. It's on speaker.
Yeah.
Spanish speaking, full conversation. I mean, just going loud. Oh my God, you can hear the person on the other end. And everybody's in the waiting room just looking at her. And I'm pissed. Cause I'm like, it's 8 o'clock in the morning and you have your phone on speaker. This is a waiting room full of people and you having a conversation and we don't want to hear it. Like we don't want to hear it, you know? And it just really drove me nuts. And I just think that that kind of stuff that drives me crazy. I'm like, take it off speaker. We don't want to hear your conversation. We didn't know what she was saying anyway. She's talking in Spanish. Regardless, we don't want to hear it. It was annoying everybody. One lady's trying to read. She had to close her book. Nobody could really like focus. I wanted to go up to the desk and say, can y'all do something about like tell this lady and she did it every day. You got to remember we did this 5 days a week. So I saw the same people. She would do it every single day. I had to get to a point where I'd be like, Anthony, there's your best friend on the phone having a full conversation. It drove me nuts. So that kind of stuff just drives me
Was she
crazy.
talking to the same person every day?
I have no idea, but she was always on speaker.
Mm.
That's the
Oh,
kind of
and
stuff that'll start a fight in a waiting
Yeah.
room.
even when they call her back to go for radiation, she was still on the phone. She don't say, "Oh, let me
She got
call
a
you
lot to
back. I'm
say.
about to go back." Oh, no, 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 no. She had it back there. She's still on the phone till they come and get her. I know it drives them nuts because it drove me crazy.
Could you?
So
I'm assuming you can't have your phone while you're actually getting radiation, right?
my phone is in there. I don't have it on me. I put it
That's
on
what
a
I'm
chair.
wondering though. I was like, was she literally still like on the phone while she was getting radiation?
No way.
It's nuts.
They let me have on my big earrings. Like
She
who
was
just
probably still talking then
I
during
think
the
it's
radiation.
depending on the area that you're getting done. But she can't
Right.
do
Yeah.
that because they're telling you, like, take a breath in, like, hold your breath and stuff. So they're like coaching you through. So she needs to get off that damn phone. Like, I'm sorry, it was terrible. It was every single day. Every day for 5 weeks, I heard it. Her full conversation. I don't even know what she's talking about, but I was like pissed that she was talking about her kids. That's what it was. That's what she was. Grown kids. That's what she was talking about.
So by the time you left, you were pretty what is it, proficient in Spanish and could understand her conversations.
Yeah. And I was not interested in it at all. You know, she was like, because I'm the parent. Like she was saying all this in Spanish. I'm the parent. If she don't like the rules, then she can leave and blah, blah. And I'm like, really, this is too early in the morning to have these kind of conversations.
Was this
But
in this state or up north?
in New York,
Oh,
this was going on, radiation, 5 days a week.
it's New
She was
York.
on that phone.
I could see
Yeah.
New York. Yeah,
New
no.
York. So yeah, those are my two.
All
And
right. That I guess that leaves me with, and so I understand if nobody votes for me because they really kind of got the better ones. But that means it's McDonald's drive-through ordering of things and the family member who knows
or
everything.
Burger King. You mean Burger King, have it your way.
You can't have it your way. Anyway.
BK, have it your way. Mhm.
I would probably do
Um,
that. I'm not gonna lie.
You know.
all right, let's do one more little segment before we've been kind of talking about our personal lives anyways, but let's do one little segment before we transition to our favorite probably time of the episode. So, I said we were going to kind of come back to this and we're going to debate this a little bit, but talking about new grads in critical care settings. What are your feelings on that? Yes or no? What do you think? So let's debate that a little bit. We'll start with Anthony. We're gonna start with Anthony this time because he's got the obviously ICU perspective of this. So what's your take on it? What's your take on new grads going into the critical care units?
I mean, I'm all for it. I really do think it's more about the person, like the nurse, than it is anything else. I've seen some like new grad nurses go in and do like amazing, fantastic jobs and just excel. And I've seen others that are doing it for the title and like they don't have any drive to be there. They don't have any drive to learn and they just flounder. So I think if you can screen your candidates well and you can provide them a good support system, then go for it.
Okay. All right. Kara, what's your take? So you have both you and Felicia have a little bit of a ICU perspective as well, obviously, as an ER perspective. So what's you guys' take on this one, or what's your take?
I think that kind of like Anthony said, it's very individualized. I'm not saying that every new grad belongs in the critical care area because that is 100% not true. However, those that have, especially those that have put in the time and maybe worked as an intern on the unit or worked as a PCT long term on a unit, and they've put in that dedication, they've shown me what kind of person they are and, their dedication level. I'm much more willing to go with that person than someone who maybe has never worked in that sort of environment before. Because
Mm.
to be honest, I think the environment itself in ICU and ER is just very stressful. And then you have all the stresses of just being a new nurse. And if you can't handle the stressors of your environment, you're never going to be able to successfully build a foundation of your nursing skills. So I say that I take every candidate individually, and I'd say about 20, maybe 30% of interviewees, I would say, are actually in a good spot to go directly in. But on the other side, I've seen it completely fail. I've seen nurses come in who say that they want the glory of being an ICU nurse, and it's usually ICU that I see them fail in.
Right.
It's that they actually can't do the autonomy and they don't have those critical thinking skills yet. And I see that they need to build on that. And that's what I recommend, another year on the floor and then trying again once you have your foundation.
Good perspective. Felicia, what's your take?
I agree with both Anthony and Kara with this. I am all for new nurses or nurses wanting to broaden themselves in nursing, but I need to see that this is something that you really want. And I have been an educator now and being an ICU educator, even though I wasn't an ICU nurse, I have seen nurses come in and wow, they've done amazing. Brand new, like had no critical care background, like, but they were humble and they received the constructive criticism and they were there writing down things. They really, really wanted that. But then there are those, and that's not just in critical care. I mean, even with the ER too, who will come in and they're not humble and they're know-it-alls, or they think they know it all, but yet they're very dangerous. Those are those ones. But I also see that in people who claim to have experience too. So I am an advocate for training somebody when they really want something because you can form them into what you want them to be. Like if this is something that they really want. Some you cannot, and those are the ones that we need to really watch out because they're dangerous. Like if you're not asking questions when you really don't know, or you're like dirty, not like washing your hands or, just taking precautions and stuff. Like I've seen that too. And those are things that are concerning. So that's how I see that. And that goes for not just with critical care. That kind of goes with nursing. Just some people think that they're getting in it for money. There's no money, people. Let me let you know, world. It's not enough money for taking care of you. Okay? Not.
It's
Just saying.
so true. It is. It's so true because I mean, and not that it's not a good paying field, because I mean it is.
It can be.
But for the trade-off of the things that you see do have to deal with, like, you have to, like, have a certain personality, because you're right, it's decent money, but it's not enough for some of the stuff you have to deal with. So you have to want it more than just wanting a paycheck. So I will say my take on this has probably been the most resistant. I was dead set against this for the longest time. I'm somebody who came from a floor setting. I did like 2 years on a med surg tele unit before I transitioned to the ER. And I've always been a very, very big proponent of going and getting that foundational knowledge before transferring into a critical care type of area. I still am on that, just not as hard as I was before. It wasn't until probably about 2, maybe 3 years ago that we started taking new graduates into the emergency department I'm the educator for now, and it's been rough, like, not gonna lie. I work at a level 2 trauma center, and we are a very busy department, and it can be very difficult to acclimate new graduates to that environment and having to pick up those skills and that critical care thinking and the prioritization and the speed and all of that that goes with it. So I still am a proponent of having people get a foundational knowledge before going into critical care. But I do feel like if you have the right candidate, there can be success stories that come with it. But generally speaking, those are going to be, honestly, people that have had previous experience in restaurant service. Like, if you can usually handle bartending or you are a waitress or something like that before, I've seen those people have the highest success rates in the ER I'm speaking of. And also, if you've been at least in a healthcare or exposed to being in, like, working in an ER specifically, I think you have a better chance. And like Felicia said too, attitude this day and age almost plays a bigger part in your success than, I don't want to say more than your knowledge, but it plays just as big a role, if not more, because
Yeah,
if you're willing to learn, there is a lot of resources out that can teach you
absolutely.
what to do, but you have to be willing to take that feedback, to be self-sufficient, want to learn, seek answers out for yourself, better yourself. And there's a lot of resources that can help you gain the knowledge and the skill set to be successful, but you have to have like that fire, like Anthony said, like you have to have a fire under you to want to do that. And that's something like, I don't know if somebody's found the magic cure out there about it, but that's something I've never get teach people. So
Well, one issue that I am finding, and this is with many organizations, is you can't put all your new staff on one shift.
yeah.
Where are your resources when we do that? We have got to disperse people. Like, I understand somebody wants to move from the night to the day, but I'm going to need to add in somebody that it is not quite for me, doesn't really know that's a new grad or whatever, if we're taking them into this mix of nurses on the days, on the mid shift or whatever that have experience. You cannot put a whole group of new nurses on the night shift. And this is going on in all the organizations because they're like, well, there are people who want to move up. I understand. I get it. But let's think about what we're doing. We're really setting them up for failure. Like, what are their resources? Who do they know to go to? Nobody has experience on the shift. You don't know any more than I know. You know, that is not, that's really a setup for them. I'm not for that. But, who am I?
Listen, yeah, we got a
I
lot
know, it's just the
of
way it is. All the what I mean, organizations do it. They be like, well, you have to start it on nights. So now all the new grads are on the night shift.
Mhm.
with no
And
resource.
there you go. All the experienced seasoned nurses are on the day shift. And then they letting them have it when they come in the next morning because they haven't done whatever from the night shift. But darn, they don't have any resources to tell them, well, hey, you needed to get a blood sugar on this patient, or you needed to do this. Like, who's teaching them? Like,
Mhm.
honestly, something's got to be done about that, because this is why we're having such a bad success rate with our nurses nowadays. I'm
I think
sorry.
that's gotten worse after COVID too, because I think a
It
lot of our
has.
senior nurses were just like, "Nope, I'm
I'm
done," and
done. I'm done.
left the
Yep, I'm
bedside.
out. That's true.
Yeah, it's crazy. That was another kind of question, but I feel like we'll save that for a different,
And we're also babying them now. We're
Mhm.
babying them.
It's
We don't allow them
it's
to
a
do
different
anything.
generation too, and like how we know we've talked about feedback before and how people receive feedback and how people are learning. Talk about the what is I don't even know whatever generation was just born, but whatever
I
generation
don't
we're
either.
on, and just kind of those differences and like how maybe some of us like school and there's a lot of, of things
I mean, we used to have to be like, suck it up, buttercup. Like, you can't get your
You can't
panties in a
say that now.
wad. No,
Nope.
you cannot. You cannot say anything to them, because if so, it's like, I feel bullied, or I feel harassed, or I feel, and you just never know what's going to happen. Like, they just can't handle it at all. And that really scares me, because you're like taking care of people. These are people's lives here. You can't accept that I'm letting you know that maybe you could do this a better way. I do say that some people do come across very rude when they are talking to people, and that maybe we got to work on a better way of delivering the message. But I don't
Mhm.
know. It's just, I feel like sometimes the toughest people who are precepting you are the ones that you, like, in the end, you just end up as a badass nurse. Like, that's what, like, it just depends. I just think it depends.
It does. All right, enough of this like healthcare nonsensical talk. Like, let's drop the stethoscope for a moment and dive in
Yes, that's
to
my
some
time. Drop
real
that
life
stethoscope.
stuff. So we'll
That's
end
it.
with Felicia because she's always got a lot of things going on outside here. So, Anthony, what's going on with you? We know from the last time you were on that you're in CRNA school. So, how's that going? What's life like for you right now?
Um, I mean, I'm coming up on my like I don't want to call it mock boards, but that's essentially what it is, practice board exam for December. So just trying to study and score well and
How
go to
how
clinical every.
how has it been going? Like, is your classes going okay? Are you still I mean, you're so smart. Like, obviously, like, you're
Yeah.
brilliant, but like, is everything going okay with studying and stuff?
Yeah, but that's a challenging part is like you say I'm smart, but I'm surrounded by very intelligent people, which can be challenging. But I mean, studying's been fine. We got front loaded with most of our classes, so I'm on the very end of my last class, and then it's pretty much all
That is for
clinical.
like
Yeah,
clinical.
because we start
Awesome.
our like residency in January.
Oh,
Yeah, so
wow.
like I'll get to go
Okay.
to some different hospital systems, see some different things, and
So you're
That's
basically
awesome.
kind of just doing clinicals from here on out?
yeah, full-time clinical.
Nice.
And I mean, I'm at one of the facilities that we, used to work at. And so
Okay.
it's interesting just even seeing like different departments within, an organization that I used to work for. Like it's kind of cool. Um,
Okay. Okay.
Oh, that's
Have you guys lost many students?
we started with 60. We actually have a very large class,
well,
Oh,
and
wow.
we've lost 5. So not
That's not bad
too
at all.
bad.
That's
yeah,
pretty
that's
good.
I mean, like kind of what we talked about earlier, the dean of our program is big on like emotional maturity and emotional intelligence, and she very much believes that like, yeah, you need to have a little bit of experience, but if you are more mature and can tackle this, then you
Then we
might be
can
more
teach
prepared,
you.
yeah, than
Yes.
somebody who has 10 years of experience but acts
Absolutely.
like a child, you
mhm,
know?
Absolutely. Absolutely.
yeah.
So,
Well, it's
but
exciting. I'm excited for
I
you.
can't wait for you to put me to
I
sleep.
I know, right?
I know. I'm excited for Anthony to be my anesthetist.
Oh my God, I can't
I was
wait.
looking at my numbers. I've already put like over 200 people to sleep,
Are you
which is
serious?
crazy. Isn't that wild?
Oh
Yeah.
my God, seriously? I got a great story for you, Anthony, that happened at a hospital that we all know
Like off the record.
where the patient
This isn't after the
a
podcast.
patient
Sorry.
no, a patient literally came in and said, "I have a history, a family history of MH."
Mm.
They said it.
You
So
better
why
take
did
them
somebody go run and
seriously.
get a cart? Why did they run and go get an MH cart? The patient wasn't being intubated for any reason. So
Wait,
can somebody explain to me what we doing? Think we lost Kara.
Kara's like, all right, guys, I'm
see
out.
ya.
she hit her Cinderella at bedtime.
That's me usually. I'm usually the one that
Yes.
turns into a pumpkin at 8 o'clock. Okay.
Well, I guess we were gonna go to Kara next, but she somehow just disappeared on us, which is fine. So I'll go next, and then we'll just end the podcast with Felicia giving us the updates on what's going on with her. I literally was telling.
There you go,
She's
Kara.
back. She's back.
I'm back.
Finish because there's not really much going on with me. But I was telling like Anthony, we were kind of talking before the podcast started, and I was like, between I feel like it's just rough right now, especially because we're coming up on the holidays. But like, I feel like I literally like I'm working every day, and one of my jobs something because I have like a million things that I'm doing, and I still feel like I'm like spinning in a hamster wheel. I can't get ahead. It's just been a lot lately, so I feel like I'm just in one of those like funks right now where I'm like I just keep trying and I'm just like going nowhere. So I'm just brutally exhausted. But
Just
Same.
keep pushing,
oh,
Brittany. You keep pushing.
it's fine. I'm always like happy though because like this when I get to like see my people and like have this like hour of like talking with you guys, it does make me feel better. So I'm happy.
Good.
All right,
Mhm.
Kara, what's going on with you, girl? You
You
got
know, life's
lots of things.
life's always busy in my world. 5 kids and 3 dogs and, working, and I'm out on leave right now, so I'm catching up on rest, which is kind of nice.
Yeah.
Good
Or
girls.
I need it
Also,
with the holidays.
I don't think they said this off air, but congratulations officially. You're
Yes.
a married woman, so
Yes,
congratulations,
congratulations.
Kara.
Yes, thank you. So yeah, married, working, kids, dogs, holidays. I'll sleep when I'm dead.
There you go. There you go.
I love
That's it.
it. Great. All right, Miss Felicia, where are you at with
Mhm.
everything right now, girl?
Well, we're in the sit and wait game, everybody. So we know I finished my 25 rounds of radiation. So I will actually be talking with the medical oncologist from New York next month. And then he's going to put me on what they call a PARP inhibitor, which is a chemotherapy drug that's more targeted towards the tumor. So hopefully I won't have to deal with too many side effects from that. I am off from anything right now, which I'm very excited about. So hopefully the tingling from my feet can go away and maybe my hands and feet can go back to normal color. So that's what we're
Is it
hoping for. If you notice, I
getting
am
better?
growing a little hair. I think that New York liked my hair. It's very weird. I've lost hair everywhere else, but not on my head, which is fine. So that's kind of where we are with that. Yesterday was my first day back to work. Boo.
Yeah.
But there's a lot going on there, and I'm just trying to not make myself feel overwhelmed and have to remember to put me first.
Yeah,
So
'cause you've
that's
been
kind of
off
where.
for a
Yeah.
decent amount of time getting your
Been
treatment.
off for over 2.5 months, and
Yeah.
it's been amazing.
Yeah.
It is. But when you come back and you realize nothing's been done
Yeah.
and you're back where you were, you feel a little bit in the rear, but you know what? I will do what I can do.
That's all you can
And
do.
I won't stress myself about it because I'm going to take care of me first. That's
All you
what
can
I'm
do.
going to do.
I
You
was
know,
asking,
that's kind of where I am.
are your side effects getting better or like the side effects you had from radiation and like your other chemo, are they starting to just
So the side effects from radiation don't kick in until after that last treatment. So I'm in the middle of those right now, unfortunately. Hopefully within 2 weeks, then those will go away. However, then as I said, I'll be starting on a PARP inhibitor, and then I don't know if I'm pretty sensitive to the medications, whether it be radiation. During radiation, I felt absolutely not, maybe just a little fatigue every now and again, but overall, no. They say they usually hit after. And then it takes 6 months before they would do a CAT scan to see how the radiation has worked. So 6 months. So we're looking at April, everybody, before we know anything. I'm just
Yeah.
praying.
Praying and
It's
waiting.
interesting. Praying and waiting, honey. And, trying to get myself motivated to put up my 7 Christmas trees, but
Have you
I haven't.
any gone up yet?
Did you just say 7?
Yeah,
You
Anthony.
know,
he said-
Felicia does things in numbers here.
Yeah.
I mean, I know
Go
that.
big or go home.
I shouldn't have been surprised. You're right.
No.
Well,
But
That's on me.
I don't feel like it. And I
okay.
know I have to.
I don't feel like it, and I don't have those problems. I would not want to put up 7 Christmas
Yeah,
trees
that
either.
sounds terrible. We put up 1 and I'm like, you
It
got
did
me.
I
take
mean,
me like 2.5 weeks, almost 3 weeks to finally decorate the tree after my boyfriend put it up. So I get that. But I actually have a great idea is I feel like we are going to do a live podcast from your house in front of your Christmas tree in December as our
Yeah.
probably last podcast of the season. We'll do our season finale at your house, live in person. Hopefully,
at my
all 5
house,
of us.
at my house.
Yes,
Oh, well, then I don't have a choice but to put up the trees
exactly.
then.
Now you
Now
gotta
that
get
tree.
it
may have
done.
just
One
given me a
tree.
little motivation.
1.
Yep.
You
Okay,
only
that
need
may
1.
have given.
Yeah, we only
Yeah,
need
it can be
one,
the
not
small one too.
7. But you
I don't
have
have
to
a
put up one.
small one, Anthony.
What do you mean you don't have a small? You put up 7 large Christmas trees?
Tell
Yeah.
him, Brittany. Tell her.
You got
Tell
every
him.
room
Kara,
with
you
a,
was here.
like its own themed Christmas. Like, yeah,
Every room
Yeah.
is differently themed.
and it's
You
amazing.
have
They're
to see
like
it.
I'm
9
trying to think
foot.
about your house. Drew, you don't even have 7. Are there 7? Wait, 1, 2.
No,
There's
there's
some in
not,
the back?
Anthony. There's not. No, there's not.
Well,
It's just
your
7.
main living room has 2, right? As like
So
2.
there's 2 in one,
Yeah.
and then there's
2
one
in
in the
another.
foyer, and then there's one in the front living room,
Okay.
and then there's one
4.
in Kenzie's room, one in my room. I gotta put one now out back. It needs to be with purple. You know that. Like everything has to have a theme.
Yeah, so we're gonna need one of them up
1
by
tree.
this time next month so that we can film our season finale.
Do we want the
Person
peppermint one or
in
do we
your
want
house.
all white?
You're
What
gonna
do
have to
we
surprise
want?
us. You're gonna have to surprise
The
us.
one
Surprise
that
us.
goes up the easiest. The one with the lights already on it.
I know that's
You know
right,
what I mean?
Anthony.
thing
I
to
don't play
say.
that anyway. All of them are pre-lit. And even my one pink tree that is 9 feet tall, I
Not
made it
that one.
pre-lit.
That's
Not
too
that
tall.
one.
No.
No,
Denied.
we
You need a
won't. We
ladder.
won't.
We're not getting on ladders.
No, we won't do that one, Anthony. We'll do the one in the front living room. I
I
don't
love
even think
this.
Lady Tree is going up. I don't think Lady Tree is going up this year. Maybe I'll do less than 7.
I love that. Okay, so there you go, folks. We will be doing a in-person, all of us podcast at Felicia's house.
Where all the
In a couple
Santas
weeks.
will be lined up and they'll be called FK Bad. They're gonna have their
Mm.
letters. So you
But we
tell
need
Don
the
he
D
can't
to
miss
show
that
up.
one.
Yeah, we
We need the D to show
need
up.
the
We
D.
do.
Yeah, for
We
sure.
do. Because we got to have the whole thing. Okay.
I love it.
I love
No,
you guys. You
thank
guys are the best.
Thank
I
you, Karen
miss you
Anthony, for
dearly.
joining us. We
Thank you,
love
Kara,
having our friends
Anthony.
here.
We
Thank you
do.
for having us.
As always, please
Miss you
like,
guys.
subscribe, comment, all of those things. And we look forward to talking to you guys next week.
Yes. Bye, everybody. Love you.